Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us. In this segment, we're going to be having a conversation with Mr. Keith Palmer. He's joining us here as Worldwide Vice President, Hip Reconstruction, DePuy Synthes. He's joining us here to talk about the changing patient population and what this means for procedures like, hip reconstruction. He'll also talk a little bit about some trends in patient needs and expectations for this type of procedure, and a little bit about the importance of aiding and empowering the surgeon to improve the hip reconstruction experience. Welcome to Health Professional Radio, Keith Palmer. Thank you for taking the time this morning.
Absolutely. Thank you so much, Neil. Really delighted to be here. And looking forward to our conversation.
Well, why don't you start off by giving our listeners a bit of insight into who Keith Palmer is? Tell us a bit about yourself and talk briefly about your role as Worldwide Vice President of Hip Reconstruction at DePuy Synthes.
Absolutely. I'd like to say Keith Palmer is just a regular guy, hardworking, born and raised in Philadelphia, and I have a tremendous opportunity to lead the hip reconstruction platform for DePuy Synthes. And currently doing so, we have a tremendous opportunity to address patient needs, help our surgeons, and keep people moving. So really excited to do that.
Hip reconstruction, is this a procedure that is just for people up in age, seniors, or are there a wide variety of situations where a hip reconstruction is indicated?
It is not just for people that are up in age. Mm-hmm. First, Neil, I will tell you that the patient is at the center of everything that we do when we think about the total hip replacement procedure. And when we think about that procedure, we think about someone's parents, someone's siblings, and even someone's significant other as well. And at DePuy Synthes, we are benefiting our patients through meaningful innovation, a combination of our enabling technologies, our surgical techniques, and our class-leading implants. Today's patient trends towards the active middle-aged adult who has different demands for post-surgery mobility than those of decades past. Mm-hmm. They have higher expectations. They expect to continue to bike, hike, mountain climb, or even participate in longer activities on foot without being held back by limited mobility and pain. And they want to do so as soon as possible following surgery.
So that being said, I'm assuming, in the past 20 years, maybe even 15 years ago, that lack of mobility, that loss of activity, doing the things that you love based on a hip reconstruction surgery, that was kind of the norm. That was expected by the patient, correct?
Correct. And again, those expectations have changed. And we at DePuy Synthes are continuing to adapt to meet those changing needs of the patient population. At DePuy Synthes, we've done this for over the past 60 years, and we believe that we are continuing to revolutionize hip reconstruction, and we're the revolutionary force driving hip trends in the industry with our technologies and our surgical techniques and our implants as well that provide that stability and reduce the need for revisions and readmissions to hospitals.
You cleared up a common misconception about hip reconstruction, that it's something, for old people. You cleared that misconception up earlier in our conversation. What are some of the newer trends as far as hip reconstruction surgery is concerned? Are we talking injuries, younger people, certain types of diseases of the bone?
Certainly injuries can result in hip reconstruction as well, or hip replacement. Additionally, certainly, arthritis and aging population can result in that as well, too. But we are helping surgeons and healthcare teams at this unique time as the COVID pandemic evolves and patients resume scheduling their hip replacement surgeries. Our solutions give surgeons confidence that they will achieve the same positive results with each and every surgery. They also alleviate the burden of fatigue in the OR for surgeons that can help them best continue to reproduce and repeat these surgical outcomes.
Are people generally much more active today than they were 20, 30 years ago when it comes to hip reconstruction or hip injuries or wearing out of the joints? Is that one of the reasons that their expectations have evolved, because the level of activity has evolved as well?
I do believe that people are generally more active these days. We've heard it say 30 is the new 20, 40 is the new 30, and people, again, want to get back to these active lifestyles, the hiking, biking, the mountain climbing, participating in some of these activities, again, that are perhaps aggressive, but certainly keep them moving and allow them to live this active lifestyle.
How do you involve the patient in the pre-surgery process, and how much of the responsibility to prepare and be ready for this surgery fall on the patient as opposed to the surgeon just knowing what they're doing and making it smooth sailing without a lot of input on the patient's part?
These days, patients want to be educated and informed. Mm-hmm. They may want to engage with their surgeon to define their surgical goals at the outset, and they may be interested, in outpatient surgeries that could mitigate lost time of work and enable them to get back on their feet even sooner as well, too. So in short, they do their research, they want to be informed, and they're looking for the progressive surgeon that has the most advanced technologies, are executing some of the latest surgical techniques, and are leveraging the implants and technique and technology to help them with the best possible surgical outcome.
Now, when you're talking about the technology, the advancements, how much has AI changed how these procedures are done as far as the efficiency?
I will tell you that our technology empowers surgeons to plan for and conduct surgery in ways that are unique to the needs of each patient, from sizing implants to positioning. When we think about some of our surgical techniques, like our anterior advantage hip suite solutions, they include hip components, surgical instruments, and digital technologies. And surgeons and the OR staff are well positioned to have these repeatable, reproducible outcomes, create these efficiencies, and even have a comprehensive portfolio that allows them to operate even more efficiently in the OR. And that's inclusive of AI and some of the other things that are offered from a technology standpoint.
Other than trying to achieve maximum efficiency in a procedure, what are some of the other stressors that technology has kind of alleviated for the surgeon in that OR? What are some of the other challenges that have been addressed?
Now, more than ever, it's an important time to address, again, the efficiencies that we talked about for surgeons and healthcare professionals. And that's why DePuy Synthes, and we are evolving delivery of healthcare with our solutions designed to reduce the complexity and improve productivity. We're focused on creating, again, that efficient OR with reduced cost care in response to some of the needs across the healthcare system, including patient and surgeons and their staff. We also are attempting to simplify procedures by reducing the number of instruments that are needed in the OR and designing systems and implementing technology that takes less space and create less waste, and supporting the growing trends towards performing procedures at outpatient facilities such as ambulatory surgery centers as well, too, as we see patient procedures moving towards ASCs.
Now, understanding that we are going to be living with COVID-19 from now on and its variants, we seem to have a bit more of a handle on it. And going forward, I suspect that we will have more of a handle on it. I pray that we will. That being said, do you think that we are back to normal year-to-year trends when it comes to hip reconstruction surgeries, even with the pandemic still looming? Are we on the trail back to some type of recognizable normal?
I don't think we're at a norm or a normal state, if you will. I do believe we're getting on the other side of the pandemic. However, still unique times. And our goal is to help surgeons and healthcare teams at this unique time, now that we're transitioning on the other side of the pandemic, and the patients resume scheduling and hip placement surgeries start to take place again. I don't believe we're at the norm. I do believe things are evolving to get back to what was the norm and perhaps what is the new norm as things change, hence the need for these enabling technologies, creating these efficiencies, and helping our healthcare teams reduce costs. DePuy Synthes MedTech Hip Solutions are revolutionizing hip reconstruction. We are empowering surgeons and healthcare teams with our combination of differentiated implants, surgical techniques, and enabling technologies that deliver accuracy, reproducibility, and operating room efficiencies that advance the standard of care for hip reconstruction.
Give us a website where our listeners can learn more.
Our listeners can absolutely learn more at DePuySynthes.com. That would allow them to get more information on our class-leading implants, our surgical techniques, as well as our enabling technologies.
And that's spelled capital DE, capital PUY, Synthes, SYNTHES.com, correct?
That's correct.
Keith, it's been a pleasure speaking with you. Thank you so much for joining us here on Health Professional Radio.
Thank you so much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Keith Palmer, Worldwide Vice President, Hip Reconstruction, DePuy Synthes. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.